Sudden loss of vision in one eye can be terrifying, but not all causes are equally dangerous. Let's explore 5 possible reasons, starting with the least worrisome and ending with the most urgent emergency. Number 5. Posterior vitreous detachment. This is the most common and least dangerous cause on our list. Posterior vitreous detachment happens when the gel inside the eye, the vitreous, naturally pulls away from the retina, usually due to aging. The main symptoms are floaters, tiny cobweb-like specks drifting in your vision, and brief flashes of light. Importantly, this condition itself is not sight-threatening. About 85% of people with this condition never develop complications. In most cases, the floaters and flashes gradually fade over a few weeks. However, any sudden increase in floaters or flashes warrants an eye exam because this condition can occasionally lead to retinal tears or detachment in a small percentage of patients. Number 4. Optic neuritis. Optic neuritis is inflammation of the optic nerve, the cable connecting your eye to the brain. It often causes eye pain, especially when moving the eye, and gradual vision loss in the affected eye. Vision usually worsens over a few days and then slowly improves over weeks to months. Most people eventually recover their vision completely or nearly completely. Optic neuritis can be alarming, but is rarely an immediate threat to permanent vision. Most cases resolve with time. It is often associated with conditions like multiple sclerosis, so doctors may run tests to look for underlying causes. Number 3. Retinal vein occlusion. A retinal vein occlusion is essentially a clot in the vein that drains blood from the retina. It can happen suddenly or over a short time. This causes blood and fluid to leak in the eye, leading to blurred or distorted vision in the affected eye. Some patients notice vision loss immediately, others notice it over hours or days. Unlike the emergency conditions below, this condition usually does not cause complete blindness. Vision may be patchy or gray rather than all at once. This condition is more serious than floaters or optic neuritis because it can lead to permanent swelling and damage in the retina if untreated. Treatment focuses on reducing eye swelling, often with injections, and controlling risk factors like hypertension or diabetes. Number 2. Retinal detachment. Retinal detachment is when the retina, the light-sensitive lining of the eye, pulls away from its normal position. This is an emergency. Warning signs include a sudden increase in floaters, flashes of light, especially in peripheral vision, a gray curtain or shadow creeping over part of the vision, or general blurring. Retinal detachment is pain-free, but the longer it goes without repair, the more likely the vision loss becomes permanent. Urgent surgical treatment is needed to reattach the retina and save vision. Number 1. Central retinal artery occlusion. The most dangerous cause is central retinal artery occlusion, effectively an eye stroke. This occurs when the main artery supplying the retina suddenly blocks, cutting off blood flow. Symptoms are classic: a sudden, profound loss of vision in one eye, usually without any pain. The vision drop is often described as a gray or black curtain coming down. This is an ocular emergency on par with a brain stroke. Without immediate intervention, often minutes to hours, the retinal cells are irreversibly damaged. Sadly, the chance of regaining vision after this condition is very low unless treated within a very short window. Each of these causes can lead to vision loss, but they differ greatly in urgency. Floaters from posterior vitreous detachment or an episode of optic neuritis, while scary, often resolve with time. On the other hand, a detached retina or a central retinal artery occlusion requires immediate medical attention to prevent permanent blindness. If you ever experience sudden vision loss in one eye, even if it seems minor, it is crucial to seek an eye specialist's evaluation right away. Thank you so much for watching. If you enjoyed the video or found it useful, feel free to like, share, and subscribe for more content.